COVID-19 has taken a toll on the whole world both financially and economically, and it has taken away the nation's overall stability. The coronavirus disease 19, or known as COVID-19, originated in Wuhan city of China in early December of 2019 and has rapidly spread, with confirmed cases globally, which had then been announced as the new global public health crisis. We all have been affected by the COVID-19 whiplash, be it as a student, a government worker, or the private sector worker. Life after life was taken along with the disease and left the world to be in a really dreadful shape. Studies had shown that the COVID-19 can be spread in various ways, but all of those had led the researchers to conclude that any sorts of direct contact would lead to higher chances of spreading the disease. It varies from direct contact with any sort of object to our hands touching, which will then be included in any kind of contact made with everything. This is due to the fact that the government has stated that there are no signs on how to detect if the infected person hadn't contaminated the place that we are currently touching. Statistics had shown on the 8th May 2022, the amount of confirmed COVID-19 cases dropped to only 2,153 in Malaysia, while as you can see from another statistic that is shown on the screen, France has the highest number of confirmed COVID-19 cases, which is then followed by Australia, Germany, and more. The ratio number of the statistics shown from the global graph is smaller in number as the confirmed COVID-19 cases were counted per million people.
Governments worldwide, including Malaysia, have implemented various measures to contain the spread of this virus, such as lockdowns, social distancing, and mask mandates. Lockdowns. Governments have imposed lockdowns or stay-at-home orders to limit people's movement and prevent the virus from spreading rapidly. These measures typically involve the closure of non-essential business, school, and public spaces. Social distancing. Social distancing measures aim to reduce close contact between individuals, which is a primary mode of virus transmission. This involves maintaining a physical distance of at least 1 to 2 meters from others in public places. Mask mandates. Many governments, including Malaysia, have implemented mandatory mask wearing policies in public spaces. Masks, particularly surgical masks or cloth masks, are effective in preventing respiratory droplets from spreading when an infected person talks, coughs, or sneezes. It is important to note that specific measures can vary across countries. Therefore, it is always advisable to refer to official government sources and guidelines for the most up-to-date and accurate information regarding the COVID-19 measures. The COVID-19 pandemic has had significant effects on various sectors including education, economy, and healthcare. Education. Schools and universities have faced disruptions with closures and transitions to remote learning. Students have faced challenges adapting to online education, including access to technology and the digital devices. Economy. The global economy has experienced a downturn due to the pandemic's impact on various sectors. Business closure, job losses, and reduced consumer spending have contributed to economic contraction. Sectors heavily reliant on physical presence and face-to-face interactions, such as retail, hospitality, and small businesses, has also been particularly affected. Healthcare. Healthcare systems have been strained due to the overwhelming number of COVID-19 cases, leading to challenges in providing adequate care for other medical conditions. Increased demand for medical supplies, equipment, and personal protective equipment, which is PPE, has put a strain on global supply chains. Efforts to mitigate the impacts and support recovery have included financial assistance, policy interventions, and adapting to new ways of operating, such as digital transformations and the implementation of health protocols.
The COVID-19 pandemic has caused unprecedented challenges for frontliners, medical professionals, essential services personnel, and caregivers in Malaysia. Medical professionals were faced with the daunting task of treating and managing COVID-19 patients, often with limited resources and mounting pressure. The sheer volume of patients requiring medical attention put a strain on healthcare facilities and staff, who had to work tirelessly to ensure that all patients were given the necessary care and attention. The pandemic has led to mental health strain issues in frontliner workers due to the long hours, high workload, and exposure to traumatic events. Essential services personnel were also essential in the fight against COVID-19. Moreover, essential services personnel such as police officers, firefighters, and transportation workers have been required to continue working to ensure the smooth running of the country amidst restrictions and lockdowns. They too are exposed to risk of infections and additional workloads as a result of the pandemic. These workers had to operate in high-risk environments while ensuring strict adherence to health and safety protocols, all while coping with a higher workload and increased stress. As for caregivers, played a crucial role in providing support for the elderly and vulnerable populations who were at heightened risk of COVID-19. The elderly and those with underlying health conditions are more vulnerable to the virus, making caregivers' roles even more challenging. Additionally, caregivers must adhere to strict hygiene protocols to prevent transmission of the virus, which has added an extra layer of workload and stress to their role, while maintaining physical distancing measures and helping their patients come to terms with the isolation brought on by the pandemic.
Hi everyone, I'm Aishi. So I have with me here Damia today, right? COVID-19 survivor. So Damia, I heard you had COVID-19 recently, and these are basically some couple of questions that based on your experience with COVID-19. Firstly, how did you know that you were positive for COVID-19, and what were some symptoms that you had?
I had COVID 2 times and both of them have symptoms to it, so it's not asymptomatic at all. I started to have like very high fever, right? Extremely bad sore throat, and really bad coughing as well. Somehow, during my second time of COVID, I experienced like such bad nausea also.
Thank you so much for your answer. Secondly, so now that you have COVID, so what actually kept you going while you were actually sick?
My assignments.
Alright, okay, seriously?
Seriously?
Alright, okay, that's nice. Last but not least, how has this experience with having COVID changed you? If so, how?
It gives me more awareness about COVID-19. It's something incurable also, right? Like, it's still going around. Like,
Yeah, you only have vaccines as prevention, but
yeah, it made me realize that I need to take care of myself more and just be aware that the virus is still there.
right. Okay, thank you so much, Damia, for sharing your experience.
Several COVID-19 vaccines have been developed and authorized for emergency use or approved for full use in different parts of the world. Here are some prominent vaccines and their effectiveness in preventing the spread of the virus. The first example is Pfizer. This vaccine is mRNA-based vaccine. Clinical trials have been shown high efficiency rate in preventing symptoms of COVID-19. The Pfizer vaccine is actually efficiency around 94% in preventing symptomatic infections. Next is AstraZeneca. The AstraZeneca vaccine is a viral vector-based vaccine using a weakened version of a chimpanzee adenovirus. So this efficiency against symptomatic COVID-19 is around 60% to 90% in preventing the infection. Unfortunately, the COVID-19 pandemic has also been accompanied by a proliferation of misinformation and conspiracy theories. So the first conspiracy theory is the theory that COVID-19 was intentionally created and released as a bioweapon, and the next is misinformation suggesting that the virus was caused by consuming certain animals or specific laboratory activities. The misinformations are false prevention and treatment claims that unproven remedies such as certain drugs or supplements can prevent or cure COVID-19, and the misinformation about the effectiveness of home remedies or alternative treatments. Next is the vaccine misinformation, is that false claims that COVID-19 vaccines are unsafe, contains microchips or altered DNA, and misinformation linking vaccines to long-term health effects or fertility issues. Fact-checking information before sharing it and promoting media literacy can also help combat the spread of misinformation and ensure that individuals have access to reliable and credible information.
The COVID-19 pandemic has had profound implications for the world's future and has provided important lessons that can shape our response to future challenges. Here are some key implications and lessons learned in terms of health preparedness. The pandemic has highlighted the need for a robust and well-funded public health system worldwide. There is a greater recognition of the importance of investing in research, surveillance, early warning system, and pandemic preparedness. The importance of science and evidence-based decision-making is the pandemic has underscored the critical role of science and evidence in guiding public health policies and interventions. The significance of transparency and timely communication of accurate information to combat misinformation and build public trust. This implication and lesson learned can guide future policies, interventions, and global collaborations to better prepare for and respond to similar challenges, ensuring a more resilient and inclusive world. The fight against COVID-19 has witnessed remarkable collaborative efforts among scientists, health experts, and governments worldwide. First is global scientific collaboration. Scientists and researchers across the globe have collaborated extensively to understand the virus, its transmission, and develop effective diagnostic treatments and vaccines. Scientific institutions, universities, and research organizations have shared data, research findings, and collaborated on clinical trials to expedite progress. The next one is cross-border research and clinical trials. Multinational clinical trials have been conducted to evaluate the safety and efficacy of potential treatments and vaccines. This collaborative research has expedited the identification of effective treatments and vaccines. The collective expertise, knowledge sharing, and global cooperation have played a vital role in guiding policy response, developing medical interventions, and mitigating the impact of COVID-19 on a global scale.